I'm Dr. Edythe Heus, and I've been studying the Stecco method of myofascial release. And I'm going to demonstrate how I use cold laser to minimize the work that I have to do in releasing the centers of coordination in the points that are related to improving the movement. I have my patient here. He's going to demonstrate the range of motion that's painful. If you could please. And the pain that he's feeling is in the joint, as well as the posterior aspect of the shoulder blade. Okay, you can put it down. And you'll also notice that he has scapular winging. All right, so I'm going to put him on the table, and I'm going to show you the points that I've already mapped out and how I'm going to treat them using the cold laser. So I've identified 3 points that the fibers are dense. The most superior point is incredibly tender. So I'm going to use the laser with my fingertips to reduce the tenderness of the point, allowing me to get in there and work more deeply on the point and reduce the density. Are you noticing an improvement in the tenderness? Okay, so already there's a noteworthy improvement, not only in the tenderness, but a change in the density. It's significantly softened. So I'm just going to go in there, right on the rib, and the density is reduced. It should be a little bit more tender than it was before, so I'm going to use the laser while I work the point, and it's in this one of the fibers of the slips of the serratus anterior. Okay, and the density is virtually gone on that. Now, following treatment of the points, there is inflammation that follows, which is expected in myofascial release. I'm going to go down to the next point. So, again, since this point is manageable, I'll go right into using the flat of my knuckle to treat the density along with the laser. And this is a red laser that I'm using to treat this point. Infrared is also incredibly effective. So if you don't get a good response with the red laser, switch to infrared. There is more density. I'm going to switch to the infrared. Now, for the purpose of the video, I'm demonstrating it in a position that might not be optimal. I'd probably have him on his side so I could use the edge of my elbow to work this point out. But as I mentioned earlier, the advantage of the laser is how it reduces the densities, and I don't have to work as hard. Now the density is gone, but there's still some tenderness there, so we'll just let that be. After doing the 3 points, I'm going to have the patient just go through the range of motion and see if there's any change in pain. So, less pain? Okay. So less pain, there's actually more fluidity of movement of the arm. So I'm going to do some associated points that will add to the work that I've just done with the serratus anterior points. The next point that I'm doing is on connective tissue that's very close to the humerus. It is a point that generally is tender, close to the bone, so the laser is very helpful and just reducing the time and the irritation to the tissue. So you can see the flash from the laser. This is red, and that the flashing is associated with the pre-programs that have been loaded in that I use. So that flashing represents different frequencies. I keep the laser close because too much of that flash is overstimulating to my nervous system. And that point is dissipated. This third point is really tender, and you can see how he tenses up. And I press it, and it's really dense and feels very chronic because of the density. So I'm going to use the infrared. And red is used on this laser to indicate that the infrared is on, but the camera does display the infrared. How is the tenderness? Is there any change? We haven't had it on very long, but what about the tenderness? I think it's diminished. Not gone. So I felt a big change in the density shift about 5 seconds ago. How is the tenderness? Is there a change in it? So the tenderness is reduced. When I initially checked these points, this one pretty much sent the patient off the table. And now I'm pushing much harder than I ever have. And actually the density is not there anymore, so I don't need to do any more with that. Thank you for watching this video. I hope it's shed some light on how you can use cold laser in your practice. I've been using cold laser for about 6 years, and every technique that I use, the benefits of the cold laser are outstanding. So as with all the techniques that I've used cold laser with, the myofascial work is responding incredibly well to the cold laser. So thanks again for joining me.